Married baby.
Sorry.
There you go.
Okay, we're live, just so you
We've
know.
only been doing the job.
Doesn't say we are.
I went ahead and make sure it was going. I was just warning you, you're being recorded.
Don't say anything seedy. I'm sure he was talking to you and not me.
Sunflower.
Yes.
Oh, no, yeah, we moved in the house.
Pushing the envelope as always.
There's a difference in it. It's not as much of a chlorine smell or taste.
See, I don't have chlorine, I'm on.
It really was the same, except for
That well water,
There we go.
Kirkland, right?
no, Kingston.
All right, we have reached the hour.
Fairdale?
Why? Oh,
Why
no,
now?
no.
We have reached the appointed time.
Yeah, go for
So,
it.
we don't have printed agendas, they're up here. And Gary, being Tasha 2.0, doesn't have them on that side, so sorry about that.
I could do that.
For those of you
Maybe.
over there. Maybe.
Give me
Yeah.
half the meeting, I'll get it there.
Okay, you work on it. So, shall we start with a roll call?
Ms. Askins.
Here.
Ms. Little.
Here.
Mr. Porterfield. Mr. Reid. Here. Mr. Whelan.
Here.
Chairman Haji.
Here.
5 present, 1 absent.
Very good. All right, so the
Oh,
next
no,
thing.
we don't have one.
Oh, she's stuck out.
Yeah, that's okay.
Yeah, but I got,
Mr. Chairman.
I got it up there now.
Mr. Chairman, would you please go back to sleep? We'll call on you when it's your turn. Okay, with that, we need an approval of the minutes, please.
So moved.
Second.
Okay.
I'm sorry, no, I didn't.
Maureen, Marge?
Marge?
Okay, Marge and Jeff.
Sounds that way.
We're used to Tosh. We'll go slow.
Jeff Whalen seconded.
Thank you.
Okay, any discussion on the minutes? No corrections? All right, all those in favor say aye.
Aye.
Those opposed? All right, we have that. And next we have approval of the agenda. Now, a little birdie whispered in my ear and was saying, pretty please, could we move Donna Moulton, like I don't know who recommended this, before the tax levy referendum, because there's something she needs to go and do.
Oh, that's fine.
But I need a motion,
I so moved.
okay?
Second.
Second, any discussion? All those in favor say aye.
Aye.
Any other discussion on the agenda? Okay, motion to approve? The whole agenda with the
Yep.
correction? Mhm. Okay.
How we did this.
Now, we approved the motion to change it. We
Right.
haven't approved the whole, this is approving the whole
Okay.
agenda. Okay, all those in favor say aye.
Aye.
Those opposed? All right, we now have a new agenda with a slight change, and Mr. Porterfield has joined us. Okay. The next thing is public comments. Is there anybody out there that would like to make a comment to this committee? No. Good. Then we have the chair's comments. Now, we do have a few guests with us tonight, so I would like to recognize them. And so that everybody will know everybody, let's just go around the room. Chairman Pietrowski,
Hey,
Chair
I
of
just said my name, so.
Chair of the County Board is here. We have Ruth Ann Tobias, who is past chair on many committees, does lots and lots of work. We have Ms Lux from the Health Department. And we have the that's the outgoing, now we have the incoming.
Good evening. My name is Lisa Gonzalez. I'm the new administrator at the DeKalb County Health Department.
And we have,
I'm Andre Joaquim. I'm the Juvenile Justice Council Coordinator out of Community Action.
with Donna. Okay,
Good deal.
all right, very good. And with that, we have chairman's comments, the rest of the chairman's comments. All right, I've been sending you guys a bunch of emails. I apologize for the number of emails, but a lot of stuff happened in the last couple of days. Did you guys get a chance to read those? Okay, so you know about the articles in the newspaper about the referendum, Representative Pritchard's opinion on it, some other good things like shoe donations and that sort of thing.
I met Miss Pritchard's thoughts on it?
He's pro.
He's pro.
Oh,
That's about all it said.
That's all.
great.
As long as the state doesn't have to raise money.
So, yeah, he's
Yeah, it's not the
pro.
state's
It's not their money.
You won't get it then.
Okay, now, next month being July, we get a little break, right? We have no meeting scheduled for July, so the next meeting is in August. So everybody gets a little reprieve from Health and Human Services. And I believe that's all I have for today. So now, the next thing we have is whatever Donna's going to talk about.
You can come on up here, Mr. Joaquin. So I just wanted to come in and chat with you a little bit about the Juvenile Justice Council, which is now a part of Community Action. We're getting ready to really get things rolling going forward. So I have just our strategic plan here, which we're going to be revising next year. So we had, the Juvenile Justice Council had been meeting whenever Ron Matakaitis was our state's attorney, and then it kind of fell off for a while, and then Richard Schmock decided that it would be a good idea for us to get things rolling again, so we reconvened the Juvenile Justice Council in 2013. And at that point, I was tricked into being the chair of the Juvenile Justice Council, which I was up until last month. Decided that being the chair of the board and also supervising the position of the Juvenile Justice Council coordinator probably was something that wasn't ethical to do. So resigned from that. But in the last couple of years, we've done all sorts of things as we've reconvened the Juvenile Justice Council. We've done surveys, we've done focus groups, we've tried to gather information from the community. We've found out a lot of misperceptions of what causes delinquency and juvenile crime and truancy and all kinds of things in our community. So ahead of us, we have a task of not only trying to reduce the number of youth that are involved in the juvenile justice system, but also to provide some education to parents, to the community, and just get the word out there of sort of what's needing to happen in our community to ensure that we can keep folks from getting into juvenile justice, into the juvenile justice system to start with. Research has shown that once a kid has a touch in the juvenile justice system, they're more likely to have touches and they're more likely to have negative consequences going forward. So as a part of what we decided to do was a program that we call ERAP. I wanted to call it FRED, but it was voted down. It did actually stand for something, but it also had the word delinquency in it, which it's a program where we're trying to get family involvement, and we decided that the word delinquency was just going to be a little bit off-putting there. So we went for ERAP, which is our early risk assessment project. So the whole idea is that whenever a youth has a contact with a police officer, if it's something for which it would be a first arrest, they get referred to the ERAP program. And in that process, we do a screening with the youth to sort of determine what their risk and protective factors are. If they score low, then basically they're told, don't do it again. Maybe you have to write what's a letter when you're sorry?
Say.
No, like a apology letter. Something like that. But we really don't have them have any more involvement in the juvenile justice system, really, sort of avert them. We've had really, really great, medium, they get referred to either Adventure Works or to YSB, to one of their programs. They do a really thorough assessment with them, identify what their strengths and weaknesses are, risks and protective factors, and then form their interventions in order to address those. They follow through, and if they complete the program, then they aren't referred to the state's attorney's office. If they come out high risk, then Peggy Carey at Court Services reviews it and might have some sort of a conference with the juvenile state's attorney to determine whether or not they're appropriate to go to ERAP or to go to court. I think that we've only had like 3 youth that have recidivated during that time, so our numbers are really great. We don't have a huge number of kiddos that have gone through the program, but look at the size of DeKalb County. But really, of the number of kids that we do have going through, we have a really, really great percentage, so we're super excited about that. The ERAP program has actually been cited by the state as being an innovative program. lots of excitement about doing some of that kind of stuff. So in the past, we've been to different conferences to present about that, and that sort of thing. So, so we're pretty proud of ourselves. We're looking for more evidence-based programs that we can bring into DeKalb County. So on the Office of Juvenile Justice and Delinquency Prevention, the OJJDP out of Washington, they state that their goal, that they have two primary responsibilities, not only to address the needs of youth who have come into contact with the juvenile justice system or who are at risk of doing so, but to protect children who are victims of abuse, violence, and crime. So to me, I'm like, man, this really touches like all these kids that are out there. So it gives us a huge opportunity to be able to figure out how we can touch these youth in different ways that we can keep them from having negative experiences whenever they're children, that continue on into adulthood, whether it be health consequences, mental health, behavioral issues, those sorts of things. So one of the things that we're doing in the ERAC program is we're introducing ACEs, which stands for Adverse Childhood Experiences, and looking at, there's a lot of studies, Kaiser Permanente did a huge study in the 80s, I believe, where they found that whenever children had adverse childhood experiences, whenever they were in childhood, that it had negative outcomes going forward, and it was correlated to the number of ACEs that they had whenever they were children. So traumatic experiences, I just love this stuff, so I'll try not to talk too long because I could do like a whole day presentation on trauma stuff. But it negatively impacts the development of children going forward and impacts their ability to hit all the milestones that they need to developing into adulthood in a successful and healthy manner. So we're pulling that ACEs stuff into our ERAP program, and we're going to be looking at that and hopefully get some correlations in there with some of the kiddos that we're working with. And of course, any of the stuff that we're talking about with child abuse, the Children's Advocacy Center, all of those things are interactive. In community action, sort of in a bigger scale, as we're talking about trauma and trauma-informed work, which we're really focused on, one of the things that we're realizing is that a lot of parents are doing a lot of damage to their kiddos. They're not meaning to. Nobody's out there sort of saying, hey, I think I'm going to see what I can do to mess up my kid. It's just they don't know. So a huge component of what we're going to do going forward is ensuring that we get information out to potential parents, starting maybe in high school, middle school, about child development, about some of those key milestones that kiddos need to be reaching in order to optimize their development going forward. Having some strategies, talking a little bit about, so maybe it's just a little yell at your kid, but let's talk about how that can impact your child going forward, how they might internalize that, how that trauma can impact them going forward. So, so at the council, sort of that umbrella piece, we're really looking overarching at what we can do in the community to be able to impact our youth positively going forward and supporting families for promoting that as much as possible. Did you want to say anything, Andre? I'm sorry. It was kind of his first stick on coming out and doing some of this stuff, and he's going to a training tomorrow, so I'm kind of packing him full these few couple of days. Poor thing, he has to actually share my office with me, so.
Oh, that is the rough part, isn't it?
It is, I know.
But I'm learning a lot.
That's the right answer. 2 points.
Well, I think Donna touched upon all the key components of the Juvenile Justice Council and what the goal is. The goal is to prevent traumatization to youth that's coming involved within the system, so they don't have any negative experiences with law enforcement. And when they proceed and they continue on, that just that one negative experience with them might cause a certain reaction whenever they see them. They might internalize it and therefore project it out as far as with negative social values and whatnot. So I think just being able to implement some of these different programs and finding out this evidence-based programs that's going to be beneficial for the community is very essential as far as going forward as a whole community.
And we're looking at some topics that are a little touchy in our culture these days, right? So we're looking at disproportionate minority contact. We're doing a study. We're partnering with NIU to do some research on that. They're also researching the effectiveness of our ERAP program.
What part of NIU is doing that?
sociology department, Jack King.
Thank you.
So we're looking at some of that kind of stuff, looking to promote positive interactions between law enforcement and youth. We're really fortunate that, as I call them, our bookend chiefs are very, very pro-community policing and are really looking at ways that they can interact a little bit more strongly with the community and have better relationships in general with the community. So both Chief Lowry and Chief Theriault are very supportive of this stuff, and so we hope to have some meetings set up with them soon so that we can promote that a little bit more and get some of this dialogue going and have some more frank discussions between our law enforcement and youth, and hopefully promote that relationship a little bit more.
I'm sure we have some questions here. One, before we go on this education piece down here.
Yes.
You talk about truancy. How are you working with the regional superintendent?
So when we first had our ERAP program, we actually had a truancy officer who was a part of that ERAP team, and the state decided, and this actually, I have to say, boggles my mind, decided they didn't want to fund truancy as a piece of that, which is so unfortunate because that truancy piece is really a great sort of precursor to some of the delinquency stuff that we see. So we're trying to figure out how we can sort of pull some more funding in to sort of reestablish that position in that way. We do still get some referrals from truancy, which is really great. But Amanda and Jeff are both participate on the council, so we definitely have that going forward. So, we have, I think one of the things that the state is most flabbergasted, which is very cool, about DeKalb County is that we have participation from the state's attorney. We have judiciary that's there. We have Judge Stuckert and Judge Buick both participate. Roger Scott's there. Like I said, our chiefs are there.
We have good people in the county.
But there's this participation that they don't have in other counties, that they can't get the judiciary there. So we're really very fortunate that we do have have that participation. And that meeting, you folks are welcome to attend. It is the third Tuesday of the month at 12 o'clock in the Gatheratorium. Did I get that right?
Yes.
Yes.
At noon?
At noon. Just noon to 1. It's just kind of a brown bag lunch sort of thing. And so we do, the structure is quarterly. We have full council meetings, and then we have committee meetings where we do the bulk of the work. It meets at the same time, so we have a monthly meeting, but we just sort of break it out in committee work that way. We did actually just get approved for our next grant year. So Andre's position got funded, half of his full-time position through the state, and then the mental health board is also funding us this year, which is great for our local support. And then we also got our ERAP program funded, so we can continue that work going forward.
Where does the
too.
funding for ERAP come from?
It comes from the state. It comes through
Also
federal
the state.
federal
Okay.
dollars passed through the state.
Okay.
Yep.
All right, I'm sure we have some questions over here. Yes, Steve?
Now, is all this through community action as opposed to court services?
It is now through community action, not court services. And part of that is because there could potentially be a topic on which Juvenile Justice Council has a strong opinion that maybe court services can't go along with as being an officer of the court. So that's certainly a piece that sort of gives us a little bit of separation so that it can be a little bit more of an entity. We're still working very closely with court services, especially with ERAP, and we'll be getting some of the stats so that we can do the research, get the research accomplished through court services.
Do you know if they still have a mentor program?
They do still have the mentor program, and this should actually help to strengthen the mentor program because we are giving the person who supervises the mentoring program fully back to court services.
Who's that?
Peggy Carey.
Yeah, Peggy.
Yeah. So, yeah, at any point, if you guys have any questions about any of that, feel free to give us a call. Come to our meetings. If you have any great ideas or if you hear about anything in the community, please pass it along our way.
Jeff?
Do you work with CASA?
We do not work with CASA.
There's something underneath all of that.
Not that Jill Olson is on some of our committees. But yeah, separate entity.
Other questions?
And if you think of any, like I said, at 2 a.m. or 3 a.m., just email me and we'll be happy to answer them for you. And you can stop in and see our cramped quarters at any time. And kind of keeps me on my shtick a little bit that I have to keep my piles in order.
Well, I'm sure you guys both.
Of course, after seeing Pete's office, I think that I have a little way to wiggle.
You know, one of the things that strikes me, and that is, you guys probably already know this, so I'm probably speaking to the choir, but when a child is in a situation and they are getting some form of abuse, whether it's physical or whether it's verbal, it doesn't matter for this part of the conversation, because they think everybody's like that. And they have nothing to bounce it off of. And what I was listening to you say is these kids have no world experience to say, well, this is right or this is wrong. The parents, maybe they don't know any better. I think one of the hardest things of parenting is knowing what your child needs and being able to give them what they need, not necessarily what they want.
Right.
But I do think that in looking at this, giving some coping skills to these kids would be really important, and letting them know what other families do, and it may not be what your family does.
Well, and I think that, somebody who does interviews at the CAC, whenever Aaron's Law season is upon us, and we're doing those presentations around in the community, our numbers almost always jump. So I think it's the same kind of thing, it's sort of getting that information into the hands of children, just letting them know, some of those kinds of things out there. But
And the last thing I want to say is, having worked with the YSB kids, they work with the Mayor's Garden, and they come out, and I've worked with them for several years, and get those kids that have gotten to an age that they're harder to convince to change their behavior.
Right.
They do what I ask them to do because they sort of have to, but just listening to the banter back and forth between the kids, maybe an earlier intervention might work better for some kids, hitting them, closer to maybe 8 years old than 13, might be a better avenue for some of those coping skills.
right. Well, we're looking at everything holistic. I mean, you guys know how I roll. You've heard me spew it a time or 6. So we're really looking at some holistic stuff. It isn't going to be a one-faceted approach. We're really looking at being able to attack it on all fronts, and come up with some creative ways that we can make an impact and get that information out there. I mean, we really do want to, the youth really are our future, and we want to see them succeed. And all of the things that we can give them earlier on are going to help to support that and to support their families as well. So I have some things going in my brain about what we can do with 4C and Head Start and some different stuff. So so we'll get there. But like I said, if you guys have any brain children that need to pop free that you need to send my way, or have you thought about, or I was listening to NPR and I was thinking about this, any of those kinds of things, the number of times I've said that, feel free to send it our way. So.
All right, well, thank you.
Thank
Nice
you.
meeting you, Andre.
Nice meeting you.
You can come back to see us anytime.
Absolutely,
Definitely.
he will, for sure.
Thank you.
All right, we're going to skedaddle then.
All right, and then the next thing we have is the public health tax levy referendum. Would you guys like to come up here and fill these nice warm seats?
Yeah, I was going to say, I warmed the seat for you, Lisa.
Oh, you want coffee?
I'll just go that way.
I don't need a cup.
Tasha doesn't drink coffee.
Thank you.
Tasha 2.0 drinks coffee, but, sorry. Tasha 2.0 drinks coffee.
Yeah, that's
Tasha
right.
doesn't drink coffee.
That's right.
Oh, yeah, our children are really that assessment.
Yeah.
It's so helpful.
What program?
Imagine.
Oh, okay.
Yeah. I really want to, like, poverty totally needs to be in there. Everything was yeah. We'll talk.
Yeah, do that. It's not there yet. Yes, you are. I was waiting for everybody to get back. Okay. We're going to go around the table and introduce ourselves because, introductions, we need to make sure that everybody knows who everybody is. So I'm Misty Haji, Sheik, Chair.
Maureen Little, Vice Chair.
Marjorie Askins.
Chris Porterfield. Jeff Whelan.
Steve Reid.
Thank you.
And you know this guy.
Yes.
We met the other day.
Okay. All right. So now we are going to talk about this referendum. And Jane and I have had several conversations over this referendum. And I'm going to let her present it, but I do want you to talk about a couple of things that you and I talked about. And one is the wording and how it has to be. And also what would happen if we do it this time versus another time. So I want you to hit both of those. Okay? Go ahead, Jane.
Thank you. And hopefully you heard the presentation at the May County Board meeting, and I'll certainly be glad to answer any questions about that. I have had a few questions and conversations with board members But this is actually the resolution, and what I was sharing with Misty today is that the health department did hire a law firm that specializes in election law, so that we would do this legally. Anytime a department hires an outside attorney, we have to have it approved by our state's attorney, and Rich Schmock did approve this. And so they drafted this resolution language for us, and when we saw this, and ballot language, and I think I shared this at the meeting as well, that we were disappointed that the ballot language has to say a new tax, because the concept of this is that, as you know, the bond payments are being retired this year, so it's the same money that people are spending for the facility, except that if the referendum passed, it would be for services. So it's more of a continuation, but it has to be worded this way, and what they said to us, having to do with state statutes and laws, is that, you know, you really, you can take care of that information in your public information campaign, and you have to be sure and educate the public about that. So, I know when Misty and I were talking about this, you know, that's one of the things we talked about, is that we would rather it not be worded exactly like it's worded, but we can't change it. So if we want to get the referendum on the ballot, this is what the resolution in the ballot language has to say. And then, you know, once again, the concept is that, you know, why now? Well, there are a couple reasons, but one really is that this is an opportunity to say to voters, and the idea of a referendum is to let the voters decide, really, to say, you know, this tax levy is retiring, and we're asking to continue the same levy, but pay for health department services instead. And it's, as you know, $650,000. So it's not the full 10% amount that's in the language. So that is part of the education challenge. But that's one of the reasons why now. And the other reason is that we're facing financial challenges that we have been, you know, since shortly after the recession, and that governmental entities are facing, and any agencies that are funded by the state or the federal government, because our funding has decreased significantly, and so we are trying to have a strategy for sustaining the services that we currently provide. And the strategy that we're in right now, that the Board of Health has decided on, is to spend down our fund balance reserves. So 2016 is our second year of a 3 to 5 year plan to do that, similar to what the county board had been doing. And, you know, the idea is just to keep buying time, because we feel that the services are valuable, and every year additional that we can provide them is valuable. So, but the Board of Health knew, and I keep looking at Ruth Ann because she is our county board rep on the board, so if you have anything to add. The Board of Health knew that that was not a long-term plan, and so that's where we came up with, you know, putting it out to the voters and letting the voters decide. And there would have to be an education campaign about what the public health department provides, how it impacts everybody in the public, and then people have to decide if there's value to that, to pay for that. So the other thing Misty mentioned was, you know, why now and not waiting till later, and part of that is that if we waited till later and let this levy retire, that would impact, the taxes would go down by $22.88 on a $200,000 home. And then you would be doing a referendum and would be asking to increase the taxes again, or, you know, a quote-unquote new tax. So, you know, that's really the thinking and the strategy. I've been working with Gary on this and the Board of Health, and that's been our thinking. In addition to the fact that, we've been taking significant hits on our grant funding, and most recently in the last state fiscal year and the current state fiscal year. And it's just a trend that is looking very dismal for continuing. And as I mentioned in the presentation, grants are our main funding source for our services. Not our only funding source, but certainly our major funding source. So that's where we're at this evening. We wanted the Health and Human Services Committee to consider voting on this, to pass it on to the full county board. Any questions or other comments?
The Board of Health has recommended this, correct?
And the Board of Health originally recommended this to the county
Yes,
board.
Obviously, I think the Board of Health really feels that this is a necessity in this time, and that we would like to continue the good work of the health department and our citizens, and this is one way to assist the department in doing that.
And please go over the things that would be cut if you did not get this. Just go over those categories again. You and I did discuss this.
Okay, well, and what I had said is that our most vulnerable programs are those that are funded by grants, and that is the maternal and child health programs, the chronic disease prevention, and emergency preparedness grants. But it would impact the maternal and child health programs most significantly because that's about 2/3 of our total grants.
It also looks like, sorry, I have your annual report in front of me, and it also looks like that's where you're providing the most contact with folks in the community as well. Is that fair to say? That makes sense.
Yes.
And that is one of the most important programs, I think, for any public health agency, is the maternal and child health, because the future of the health of our communities depends on healthy kids and healthy moms. And so to enable the department to continue providing that service and reaching out now, especially when there's so much more need in the community.
And that is also the program that I come into contact with most often in my day job. Is every client that comes through Safe Passage gets referred to the health department as a matter of course, because the WIC program makes a huge difference for the health and safety of our clients. And so,
Everybody know what WIC is? Women and Children.
women, infants, and children.
Women, infants, and children. Okay.
It makes a huge difference in mothers being able to meet the nutritional needs of their children. And I mean, we have talked, I am very much in support of at least putting the question to the voters. Not only am I in favor of that, I'll be voting for it if it makes it to the ballot. But I think the work that you do in public health is so important, and a lot of times invisible, right? That when public health is working, nobody sees it.
Exactly.
We got a little peek at it earlier this month when y'all had to respond to a measles outbreak. And that's exactly the kind of thing we want to make sure is well funded and well supported, I think. So
That is the one thing, you just reminded me, thank you, that I think I forgot to mention at the county board meeting is that while the maternal child health programs would be the most impacted, those staff jump in and help us with responses to emergency events, because in reality, we don't have that many staff. So if we have a disease outbreak or if we have a public health emergency, we're pulling all of those people in. And, if we end up having to reduce that staffing level and those services more, it will reduce our capacity to be able to respond to public health problems. So,
Measles wasn't the only one this year.
It wasn't.
There was also mumps.
mumps, measles and mumps, yep.
how many staff do you have?
And I have to say this for Mark because he's always asking me about restaurants. You'll like
Still
this
waiting
one,
for
Mark.
that list.
I know you are.
I'm not joking too. I don't want it. You can privately mail it to me if you don't want it.
Now, wait a minute, I want the list too.
Well, we are
The list.
working with IMO. We really want to put that on, have that available on our website, which some health departments do, but that will be coming. But we did have a case of a worker in a food establishment who had hepatitis A recently. And had all of, yeah.
Your favorite place? Your favorite dining place? That's where it happened.
And we, you know, so we had all of those employees in for vaccinations and so forth. So, you know, that's another place where you don't really see public health at work, but most people do eat at restaurants and. Don't ever ask the food inspector where you should and shouldn't go because you don't want to hear.
I can only imagine. You'd end up eating home.
And what we're talking about, you're talking about a 0.1% of the 20.
No, the 10% is the maximum levy, and that's what I was talking about, that this ballot language has to say the 10%. But we are asking for $650,000 a year, which is the current tax levy that's retiring this year.
And what percent is that?
It's just under 4 cents. The ballot language carries this 10 cents. The actual $650,000 would be just under 4 cents. And Mark,
Real quick, is the Veterans Commission and the Mental Health Board at the 10% max?
no, veterans, they only by statute have, I want to say it's 3.5 cents or 4, somewhere in there. Mental health actually has a 15-cent max, but they're around 10 or 11 cents, I believe.
One thing that you mentioned a minute ago is you said that currently, if the taxes went away, it would be $22.88 on a $200,000 home. But I'm looking on page 4 on ballot language, and it talks about 100,000, referendum of 100,000 is $33.33.
I know that's because the ballot language has the maximum that can be levied, which is the 10%, and we're not going to be levying the maximum.
We're not getting $21 million?
No. No.
Somebody had a question on staffing. I don't know,
Yeah,
Mark.
how many staff do you have, like FTE?
We have about 41 FTEs
Okay.
right now with everybody.
And how
But-
many have you reduced?
I was going to say, your reductions were how many?
46%
Over what
since
period of time?
2010. And I think,
Do you have the count?
let's see, I do have the
34, I thought I
count.
read. Did I read 34?
Yeah. I have it marked
It's a
right
pretty
here.
significant reduction in staff.
If memory serves.
Because I get the FTEs and the people confused. 40 fewer people, 34 FTEs.
34, there's the number.
So, yeah, it's 34 FTEs, full-time equivalents. So.
I have a question. So is this authorizing the larger amount even though you're levying a smaller amount? Is that what this
Yeah,
is doing?
the language actually does do the higher amount, and that's.
So can
that's
it change after it passes?
Well,
If they're getting 3 cents now, whatever, can they change it next year, whatever, if it passes to 5 cents?
no, because what we will do is pass a levy at the $650,000 level, and then that's subject forever to the tax cap law, which can only increment.
So it can go up 5%?
Well, that's the maximum under tax cap. Mostly, it's new construction and cost of living, which for us has been about 1.5% the last 2 or 3 years. So it's not 5%; it's more like the 1.5%.
But this portion, what can it go up legally then?
It will be, once it's adopted, it will be under the tax cap. So whatever those
Whatever
parameters
tax-
are each year. But you couldn't just say, oh, $650 this year, next year I want $1 million. You won't be able to do that.
But it could go higher in the future.
Well, it'll go up by
Incrementally.
just like it has done through the years.
I
All
think
our
what-
levies do
What you're
that.
asking is, it's a 10% maximum, and if you ask for all 10% right now, and you got it passed, then it would be at 10%. But if you don't ask for 10%, and you ask for 5%, I'm making up the numbers.
No, but I got to correct you. That is not right. We are asking for the 10 cents because we have to by law.
Okay.
But the county board will levy the $650,000 level. So that's what's the controlling factor on that. But by statute, we have to have this ballot language in
The
here.
old bond amount, that wasn't subject to change, was it?
Yeah, it's gone up.
Did it?
I think we incremented it $25,000 a year. 25 or 50, 50 maybe in the early years, 25 in the later years. That was not subject to the cap when it was the bond issue.
You didn't let me finish. What I was saying is
Okay.
if you asked for
Well-
5% and then decided you wanted 7%, you'd have to have a new referendum. That's where I was going with that.
My apologies, but the first preamble was a little.
I don't claim to be a
Concerning.
lawyer, okay?
So you're telling me that statute forces us to present things in a way that the public is going to be suspicious of?
Absolutely.
Mhm.
If you are against this referendum, it's the best language you could possibly have. If you're for this referendum, it's the worst language you could have.
Right,
It's-
right, yeah, exactly, right.
I don't know if it's the worst.
Okay.
But it doesn't help.
Well,
Maybe not,
well, if I was running a campaign, I wouldn't want to do it this way.
It could be worse.
Yeah, maybe.
Questions? Yes, Chris?
As we try to sell this, assuming we vote, as we try to sell this, the question's going to be, what really should you cut? Where really is there something you can cut to be the least? I mean, mothers and newborns sounds like an alarmist explanation.
But it's true.
That's fine. That's fine. I'm glad to hear that. But the case needs to be made that there is no other
Correct.
place less harmful than cutting back on mothers and children. You understand what I'm saying?
Well, mothers and children are supported mostly by grants.
Right.
Yeah.
That's why you're saying that.
I followed you up until your very last sentence.
If we're trying to get this passed
Right.
by the public, and we go to the public and say, we've got to pass this because otherwise they're going to cut back on
Yeah.
mothers and children,
Yeah.
on services for mothers and children. The public's going to say, oh yeah, sure. What are they really good? Well, there's got to be some better place to cut back.
Oh.
So what we need to hear, and we need to be able to sell, is there is no place that would be less harmful that could be cut.
I think you have to
I think
look
we go
at
back to those numbers.
and what's already been cut. You know, home care is gone, and Jane
Well,
can
and
probably.
also just an understanding of the health department's business model, that if they're funded by grants and this is the grant funding that's decreasing, that's where we need to make up funding, right? Like, that's just an understanding of their revenue sources and how they're,
That's positing that the grants can't be moved to some other program.
It sounds like you're
How
cutting the
grants
football
work.
team, is what
That they
it
can't be
sounds like.
So no grants can be moved.
No, they're allocated for very specific purposes. Yeah.
Right.
And no other
And you
funding.
can't get grants from the state.
Right.
Yeah.
Yeah, well, you can, but they're not gonna pay you. Yeah. Believe me when I tell you.
I'm with Marge, I'm voting for this. What I'm saying is, the issue is, how do you sell this?
No, I totally appreciate what you're saying, Chris, and I think, you know, the issues of mothers and children is true, what we've said, but, you know, the other thing is, public health does affect everybody in the community, in addition to mothers and children, and I think that's a matter of knowing how. You know, people aren't going to value the services provided unless they know what they are and what they do, and the truth of the matter is, you know, you cut so much and you keep going, and it really does affect all of the services. You know, some people relate to recycling, because to some people that's really important to them. A lot of people relate to animal control because they love their animals. You know, at some point, you cut your administration and your overhead and your infrastructure, it really impacts the entire
Turn it
department.
around. Some people don't relate to animal control. They're gonna say, well, I don't care about the dogs, take care of the mothers.
Yes, yes.
Your state mandated to have animals.
Yeah, exactly.
I would like to hear something from Lisa. She's the one that's going to be sitting in the hot seat.
Sure.
Lisa, please give us your take on this.
Sure. So before I give you my take, I'll give you a little bit of background about my experience in public health, and it has mostly been under maternal child health. And so I might be a little bit biased and probably most knowledgeable about that area. But I mean, to reiterate what Jane has already said,
from what I can gather and what I knew before even coming on board at DeKalb, they have already cut and cut and cut some more in order to be able to sustain the services that they have. If you look at similar sized health departments, the model that we're using is very similar in that we're cross-training everyone to do a little bit of everything in order to be able to sustain the services that we offer. So I think that, you know, when you talk about how do you sell it, well, you try to focus on things that would affect the entire population, right? Because you're trying to find where do they relate exactly. Maybe some people don't really care about young moms and children. Maybe they don't care about animals, but people are usually concerned about our ability to respond during an emergency situation. I think that's pretty relatable no matter who you are. You do not want communicable disease or some sort of disaster to happen in your community. So you focus on that. I really don't think, based on what I can gather and what I knew about DeKalb County Health Department before coming back to the health department, there really isn't much more to cut. So if the funding gets cut, then we'll have to cut programs and or people in order to be able to sustain the department. And so I as far as the tax dollars go, this is an option. This is an option to help sustain the services that we're providing. You can look at our annual report. You can see what we've been providing. And you can also see that with the number of staff we're providing a lot of service to the community, given the number of staff that we have on staff at the health department. So, you know, that's about the best I've got for you. I mean, I could go on and on about maternal and child health and why it's so important and why it's so critical. You listened to the presentation before about child trauma and the ability to case manage these young moms and the children. We're playing a huge role there. And we're a referral source for so many people. And we also refer out to so many agencies in the community to make sure that these at-risk families are surrounded in services to give them the best option at a positive outcome. That's about all I can, you know, say more than what Jane's already said. I'm kind of reiterating the same thing, but yeah, I mean, obviously, I think that this is a good idea. It's a good option, and I hope that you will also think so.
Yes, Mark.
Jane knows I had some reservations about this plan and everything before, but I want to reiterate that I think the health department is extremely important to the county, and we need a strong, vibrant health department. If we're going to, for generations to come, if we're going to have a healthy community. I think that right now we're thinking short-term plug plan, and we need to be thinking long-term sustainability plan. How do we sustain? I know when Jane gave her presentation, if we don't pass a referendum at the $650,000 levy once we fix it, the reserves will sustain it until 2021. If we do pass it, projection 2026, which means that 2026, if the state doesn't get better, which we'll see if that happens, and everything else, we're still going to be faced with a dilemma of what do we do at that stage. So what I'm proposing and what I'd like to see us do, one, work with our new health director, let her get her feet wet, let her see the department, how it runs, where we need extra help, where we need maybe more programs, different things like that. Work with Jane as well, like they're doing with the crossover, just to see, get the institutional knowledge, make sure that stays. Also, what we need to do is work with the Board of Health, with the county board, get us all communicating together on the same thought process in terms of funding and future funding and how we can sustain these programs for the long term. That may mean going for the full rate, not doing giving it back, because you're losing out a lot of dollars by doing that. But also means you have to really sell that to the public. How do you sell that where the public, people are moving out of the state because they're saying property taxes are too high. You know, this is a major problem, and this is a property tax increase. Or it will appear that way on the ballot.
Yeah.
And in a presidential election, when we're going to have a huge turnout in DeKalb County, you're going to have to generate and raise, $60,000 just to reach all those voters. That's not going to happen necessarily, probably. So if we all work together, if we try to come up with a long-term plan, don't put it on the ballot in the fall, but look at putting it on the ballot in the spring. Not trying to say that we're just sell it like we sold, the mental health board and everything. Try to say that this is a desperate need and go for the full 10%. Don't try to, because that's gonna hurt us in the long run if we don't, I believe. And we've gotta work on sustaining the health department. Now, that would be a tough challenge, but there'd be less voters to reach out to. So that's an option. All I'm saying is that it's an option. I won't be supporting putting this on the ballot in the fall because I just think that we need to plan more for making this sustainable so we're not going to be faced with this same dilemma in 2021, 2026, whatever it is. So, I think we really need to all work together on this because our county, the fact that we have, and this isn't the health department, but the nursing home out there, it's a public nursing home. That's amazing that we're able to sustain that as a county. When I go to county board meetings with other chairs, there's so many that have privatized theirs, and that hurts the entire community. And it would hurt our community if we continue to lose out on our healthcare programs because the state and the federal government are shirking their responsibilities to provide funding for those activities. So we have to look at how we can fund it ourselves, assuming in the future that the state's not going to be there, that the federal government's not going to be there either. That's tough. That's tough to do and tough to sell to the public. But I think it would be more manageable to do it in the spring election where there's less voters to reach out to. And I think in terms of honesty, just saying that, yeah, it's a new tax and it's going to be a new tax, but this is for a new and improved in terms of long sustainability health department where it's not going to all of a sudden these programs we give them 5 more years of survival and then they get cut in years 6 or 7.
Let me oh.
I'm sorry, I wanted to respond to some of that, if that's okay. I hear your concerns about this being potentially a stopgap measure, but I think a stopgap measure that buys you 5 additional years to do the long-term planning that needs to be done in order to figure out how to make up the funding that needs to happen in the long term, that takes you from 5 years to 10 years of additional sustainability for this, what we all know to be a vital program, right? I think that makes a huge difference for our new director in terms of coming up with some strategic options in order to keep this program sustainable. And beyond that, I think regardless of when you ask for it, it's going to be a tough sell, right? I think it's a tough sell in November. I think it's a tough sell in the spring. I think there are benefits to the people who will be doing the campaign legwork on this issue to try to sell it in the fall. I think to sell it as a subscription service, right? That this is your annual opportunity to re-up on your public health program, right? That you have the option here of continuing to fund this program at the same level you've been funding it all along, and how that is beneficial to like I said, the work of the people who are going to have to try to sell this to the public. I think that presents an opportunity that you only get one time. Beyond that, I think you also have the option of asking again in the spring if it doesn't succeed, right? That we don't lose the benefits of bringing this referendum to the public in the spring by bringing it in the fall as well. Does that make sense? Yeah.
Ruth Ann wants to say something, and I want to say something.
I'm going to disagree about the part of having to reach fewer voters in the spring. I just think it's that much harder because it's not a presidential election, time, and there'll be more people listening now and more interested, and you're going to have to reach the same
Well,
number
there'll
of
be more people voting, but there'll be more people voting and seeing what's on the ballot and not knowing the education aspect that goes along with it. So they're going to see $33 on a $100,000 home. That's me. I'm going to pay $66 extra. Nope. And then that's the kind of thing.
That's what you're going to see. Yeah. I agree.
Whereas now you have an opportunity to educate the public to say, this you're already paying less than this, and you will continue to pay less than this, and we lose that opportunity if we don't put this question on the ballot for November.
Chris?
Is there, not knowing anything about this really, is there an issue, do we have enough time
Well, I was going to get to some of this and I got interrupted, so.
But as we think about time, we want to think about a comparison of trying to do it in November as opposed to trying to do it.
Right.
Thank you.
But there was a couple of things, and you feel free to jump back in as soon as I get through this, okay? But I like to listen to everybody else too, so, you know, some things that we need to look at is, one is the short time frame. I mean, this is already June. A lot of times when you put something on a ballot for November, you have a lot more months to do that education piece. It does concern me that even though Jane has volunteered to work her little fingers to the bone to make this happen, and we do appreciate that, no question there, it is something that we need to consider because it's already mid-June. And by the time this gets to county board, it'll be the end of June. We don't even meet in July, and then you have August, September, and you're there, October, and you're there. A couple of other things are, one is that people just got their tax bills. That bite is right there in front of them, and they know it. And mine went up a whole house payment spread over the year. So that's a lot that it went up. So I joke I make 13 house payments, one goes to the county. Then the other couple of things is, one is we need to look at what we would do if it didn't pass. And I haven't heard anything from you guys on what we would do alternatively if it didn't pass. And I just think we ought to have both sides so that it's balanced when you're making a decision. You know, okay, this is what it will be if it does pass, and this is what it will be if it doesn't pass. And finally, to keep in mind that we're not the only taxing body that wants to raise any form of taxing. Not only do we have in front of us the property tax bite, but there's also the school districts that are trying to raise sales tax 1%, and et cetera, et cetera. And you guys know all those things, so I won't go there. But those are some of.
I don't think, but did you hear anything else?
No, but it's in the news. It's perception.
Yeah.
I'm working on perception because that's how you get referendums passed or defeated, is the perception of the public. And so you have to look at it. How would I feel if I were out there, Joe Q Public, and I just got a big tax bite? I've heard that they want to raise another sales tax, and I heard this and that. And now I get this, and I see this humongous set of $21 million. Yikes! So, all right, Chris, did you have more for that?
I don't know if we I appreciate what you said. I don't know if we know enough, or certainly I don't know enough on whether we have enough time, whether the time exists to get ready for this or not for November. It's an issue, it's a concern, but is it possible? And do we gain anything by waiting until the spring in terms of time?
Well,
You wait until the spring, then you've got the holidays going on, you've got a presidential inauguration and people going to Canada. No, I think and whatever else is going on.
I sure hope not.
Marge mentioned that you may have to run it more than once. I certainly know to get the referendum for the new high school, it took several chances. It takes 3 or 4 times sometimes. So that's why I said we need a plan on what happens if it doesn't pass the first time. We do need to have some kind of an action plan in our back pocket. Jeff wanted to say something.
Yeah, Gary can vouch for this. We put the jail referendum on a ballot. How many times, Gary? 3 or 4?
No, for the jail itself was twice.
Yeah, twice.
And a third time was just for a property tax relief, and that was defeated.
So it's one of those things that, I just got my tax bill, and it's just like, good grief. I haven't had a raise in 8 years, but they've raised my property tax all this time. So that's the thing people look at. And a lot of the people who work at Northern some of those professors haven't had raises in 5 or 6 years, and they're saying, well, I haven't had a raise in this long a period of time. Why can I afford another $33 a month on my tax bill? Or can I afford a 1% sales tax on all these things too? All these things are coming into mind, and they say, where are you going to give us a break? Or have you really cut? They're going to ask, have you really made the cuts that are necessary? Can we see what you've cut? The only way we can advertise this and sell it to the public, like Mr. Porterfield's saying here, is that we tell them what the health department does for the community. If you have someone, we can't go in and examine a restaurant and all of a sudden you have an outbreak where somebody gets salmonella and you have 10, 20, 30, 40 people get sick. They say, well, why didn't you examine that restaurant? Well, because we don't have the staff. That's one way of saying it. The other is saying, well, we don't have nobody give you measles injections or mumps injections because we just don't have it because we had to cut that staff. So,
And I
and
think,
people,
Jeff,
when they
I
see
think
that,
that is the hard thing when you're sitting in my seat or Lisa's seat is that, and I understand, people do not want their taxes to go up, and people are upset that their taxes increased. But I'm going to tell you, they want the services.
Right.
And they are not very understanding when you say, I'm short-staffed, or I'm sorry that you called and somebody didn't return your message.
that's the idea what we have to sell to the general public, because if they get that idea that we're going to have this all cut, you know, it's like somebody up in well and septic, you've got to go out and check those, and it's, hey, I can't build a house or something like that because I can't get a check.
A few things I just wanted to respond to, and I really do appreciate hearing from you, because I think this would be hard whenever we would go out with a referendum, because it's hard to pass a referendum, especially the first time around, like you said. But I did want the committee to know that there is a citizens committee that is formed, and they are ready to go on June 15th should the county board vote for this. Bob Pritchard did tell me that if the county board votes to put this on a referendum, he will help and he will be supporting this and be behind it. I think fundraising would have to be done. Mark is absolutely right. And that's part of what a committee does. I know that Kishwaukee College did not raise near that much, Mark, for theirs.
It was in a non-presidential year.
I didn't know the exact amount, but you know,
I think it was 45,000.
what you're saying is absolutely true. There would have to be an education campaign. There would have to be money raised to do that. And to answer Misty's question about what if it doesn't pass, I can tell you that the minute we put this on the referendum, if it doesn't pass, we will be cutting staff and services. And you were also talking about what's the next plan for funding. And the thing about funding, and you know, any of you who may work with grants programs, is that once you eliminate a program, it sounds like it would be easy to start it up again, but it really is not, especially a grant program. It's very difficult to get that back from the state, if you ever had it, and to get it up and going again. They are administratively complex programs. So I'm just trying to present some other information. I think, you know, there's been a lot of good information to consider.
One of the things that you might consider let's talk the education piece for just a minute. One of our major voting blocks in the county is our elderly. And one of the things that the elderly have
everywhere, right? Not just the county.
They do. They don't want their taxes to go up, so you've got to talk to them about, well, you're over 65, this doesn't affect you, or whatever. You also have to talk to them about the fact that immunizations do affect them. If you don't immunize the children when they're little, the chances of them getting immunized are very slim. And
you lose that herd immunity.
You lose that, yes. And then who does that affect the most? Is the elderly. They're the most vulnerable.
So you're saying you should send out postcards, vote for this or you will die?
Yes! Something like that. Signed, Mark Pietrowski.
There you go.
Yes,
Campaigning.
You will die.
Give them hope or give them fear? Real quick.
Wait, Chris wanted to say something.
No, go ahead.
Go ahead.
You're on.
Go ahead.
Okay. So Jane, if this doesn't pass, the plan to spend down reserves to try to cover your shortfalls is the wrong word here, but that would not keep you from cutting programs immediately.
Well, the issue is that if we know there's going to be no increase in revenue, then just like we started in 2010 preparing for today, we're going to have to start right away. You don't wait until you have nothing left.
Okay.
And then the question will come that someone will ask, well, what about attrition? So,
Yes, I mean, many of these people are through, some were through layoffs. We had 2 major layoffs, but all the others are through attrition. I was just going through this with Lisa today. Our many different restructures that we've had since I've been in this position. Every time somebody leaves, we restructure to make it less expensive. And we consolidate positions to do that and reduce the cost. You have to.
And I would
Everybody's
imagine
doing that.
Increasing workload for
Yes.
everybody who's
Absolutely.
understaffed, right?
Have you had to
Mark.
eliminate any programs because of staff shortages? Things that you used to do that you don't do now?
We eliminated our well child program, we eliminated our home care program, as you know. We eliminated our sandwich, our satellite sites in Sandwich where we did maternal and child health services, which is really tough because it's a long drive for those folks.
Well, a lot of the people who qualify for that have major transportation barriers.
Right.
Mark wants to say something. He's been waiting patiently.
The one of the things that Marjorie brought up, you know, if we do get a pass, then it does buy us the 5-6 years to do further planning and everything. But my thought is, if we're going to get voters on board with this, we need to have that already thought out in terms of how would we utilize this funds to the best of our ability, and how would it be a long-term solution, again, instead of the stopgap. And if we're going to use those 5 years, how are we going to use it? We need to show the voters how we're going to use those years to make sure that, you know, we don't just have to cut some of these needed programs in 2026, that we can utilize this funding and with restructuring or whatever we have to do with the director and everything like that, looking at this department, make it long sustaining for years and years after.
I think what you're getting at is you want the voters to know we're not going to come back tomorrow and ask for another one. We want it.
That, yeah, and also just knowing that,
That this money is gonna help.
yes, and it's not gonna be like, oh, you know what, thanks for helping for 5 years, but now it's gone.
We need more.
Yeah, it's gone.
Give us more.
So, and that will
Just a second,
take
Steve.
strategic thinking, strategic planning, working with the Board of Health, working with, you know, all the employees, all the county board members, all getting our heads together to see how do we make this sustainable. Because I have faith in the voters that, you know, nobody likes their taxes increased or anything like that, but if you can demonstrate how it's going to be a long-term solution for the fact, and I don't care about knocking down the state or federal governments right now because they've not been doing their duties, quite frankly. And we just rip on them for not doing their responsibility, and we're having to pick up the slack.
Okay. Steve wanted to say something.
Yeah,
Just a
I need
minute, Chris.
clarification now. You're going to be getting another $650,000 a year. Now, how come this only going to last 5 years or help you for 5 years? Why is
Well,
it going to be a problem after 5 years?
You know,
You're talking about
we
inflation
did
or what?
a long-term projection, and, you know, a long-term projection out 10 years is a guess. What we did was we projected out with a revenue decrease of 3% a year, because
Okay.
that's what our revenue decrease has been the last 2 years. Taxes increasing,
Chris.
I think.
Chris. Go ahead.
Expenses increasing 1% and taxes increasing 1.5%. And I've had various feedback from various people saying, well, that won't stay that way for 10 years. You know, that is probably, and so what we came up with was actually 6 years difference between without a referendum and with the referendum. And I think that's probably a conservative guess. I am certainly hoping that it would be longer than 6 years, between 6 and 10 years. You know, in the last 5 years, you do a budget every year and you're guessing. We've been able to do better than what we guessed most every year, although it's getting much tighter. But this is kind of the worst case scenario.
So you're projecting lower revenue coming
We're
in,
projecting
so you
continued
need
lower
this,
revenue.
yeah, from other sources.
Not
so
all
you
the
need
first
this
year, you know.
Eventually.
Right.
Okay.
Right. And that's based on, like I said, our last 2 years of revenue.
Okay, Chris.
I'm thinking, I'm not sure what the political strategy should be for this, but I'm inclined to think that we should vote in favor of this, pushing this forward to the county board, and the county board making the decision on what they want to do. And I think the role of this committee, I think, is partially to endorse the actions and the programs that we are involved with, and to support their continued existence. And I think if we were to decide not to vote for this, I think that's again,
Are you making a
against the role of the
motion?
committee.
Yeah.
Chris, are you making a motion?
I'm making a motion.
And what is your motion,
So
sir?
moved.
What is your motion, sir?
There's probably wording here someplace. My motion is that Health and Human Services put forward to the county board the suggested levy.
This thingy here.
This thingy here.
Technical jargon.
Resolution,
exactly.
yeah, 2016, double X.
Yes.
I'll
Okay,
second.
we have a second. Great. Okay. Now, discussion on the motion.
Yeah, I agree with Chris. I think the question before us today is, do we pass this along to the county board? And ultimately, is the county board going to face the question of, do we put this question on the ballot? And I think it is, to a certain extent, those of us who know and support the health department and the good work that they do, we can advocate for putting this question on the ballot for that reason. But ultimately, the job of the county board is to simply ask the voters,
Yes.
right? And that's the whole purpose of what we're doing here today, is to just ask the voters, are you willing to continue to support this vital organization? So I think,
And I think it's up to the county board as to determine whether or not we want to put it on a November ballot, or we want to put it in the spring.
right. And the reason we're dealing with it in June is because if we don't do it in June,
It's
we
not
have to
gonna
wait
make it to
until
November.
spring.
But
Right.
this actual resolution is for the November ballot.
It
Yes.
is. But what Chris's motion says, if I understand him correctly, is passing this to the next level.
Yeah.
Not deciding whether it should be on November or some other
We don't have the power
time.
to do that.
Right.
No, what he is suggesting is this goes to exec and then to the full county board, assuming that it passes exec.
Well,
Yes, Gary?
at the risk of not understanding you, it will say November when it gets to the
It will,
county board.
yes.
If the county board approves it, it will be November.
Correct.
There will not be a second question,
Yeah.
what
The
month?
county will have to vote up or down on the November.
Yes.
So
Yeah,
and then at a
correct.
later date, vote on April if that. yeah.
Right.
Correct, but the motion is to put it forward as it's written right here.
Right.
Yes.
Okay, any other discussion? All those in favor?
Aye.
Those opposed? Hearing none? All right,
It goes on.
then, we are now moving on to old business / new business. You may have noticed that our intern is not here. I got an email today saying that he had to work, but he will be at exec and he'll be at the full county board meeting. So he has to do something at work. I don't know what that is, but after he became our intern, he had to take a job, so you know how that goes. Any other old business? Any new business? All right.
I was just gonna say real quick before we adjourn or whatever, but yeah, I think, and despite my thoughts on it and everything like that, I want the whole board to vote on this, just like I brought Jane in for a meeting with them, or not a meeting, a presentation with the whole board. Similarly, this is important enough that it shouldn't be stopped at executive. It should go forward for everybody to have a chance to say what they like about it, what they don't like about it, everything like that. So. And I'm sure you're already planning to be there, Jane and Lisa. Yeah.
Okay. Anything for the good of the order? All right, with that, we're going to invite Lisa to come back to all of our meetings anytime she feels like
Aren't we
it.
fun?
So far, so good.
I have a motion for adjournment. And a second. All those in favor say aye.
Aye.
Those opposed, sleep on the chairs.
Hey, Mark.
Oh, who said okay?
All right.
I will send you an email with all the information to that.
I believe everybody did.
Oh,
One,
no,
two,
it's already
three,
happened.
4, 5, 6. Yep.
I will I believe we got everybody.
Better if I remember to turn it in.
Yeah, the county administrator.
Yeah, okay.
You gotta turn your box off here.
Oh.